grow out through your skin with the potential. Absolutely. I actually do a lot of vaginal birth care. I just don't really talk about it much on this platform anyways, but lots of one-on-one care. So if you are interested in either doing an online program or one-on-one care to prepare for or rehabilitate from your vaginal birth, please send me a DM. Just literally write vaginal birth prep, please, or vaginal birth rehab, please, and I'll make sure that we connect and that I can help point you into the right direction. Ingrown hairs after a cesarean is actually quite common, so here's how you want to prevent them. Instead of shaving right down to your skin, clip the hair instead. So you want to leave a little bit of stubble. That way the hair is never below or deep to your skin level and trying to grow out through your skin with the potential of becoming ingrown. Okay, so that's one big thing. Now, if you already have an ingrown hair, like hot or like warm compresses to the inflamed area is going to help coax that hair to grow back out. But in more extreme cases, this may be something that you might want to see your doctor for because it might be just like an isolated, constantly infected area. I personally would not recommend hair removal creams on the scar because those are aggressive sort of creams designed to break down tissues like hair tissue, and on a healing scar they may not be optimal. So many things you could do to prepare for your cesarean birth, but there are a handful of key things and they're listed in this free resource down below. It's kind of a tongue-in-cheek title called The 10 Things Your Doctor Wants to Tell You About Your Cesarean but doesn't have time for, and it covers things like pain modulation, how to set up for your house, key things to think about, such as like don't get sick because you can't cough your brains out when you have a new abdominal infection, what you want to do in terms of abdominal compression ahead of time, so like an ab wrap versus a compression wrap, these kinds of things. It's a list that gets the conversation started because once you are armed with some information, you end up having more questions, but you end up having better questions. So take a look at this free resource to get started. I love that this mom is so proactive because most people don't know that there are just a handful of key things you can do in the first 6 weeks after cesarean that can make a massive impact on your recovery for like weeks and months and even years to come. So those first 6 weeks can be very crucial. I have created a free resource down here, so please download it, and it is going to tell you about things like, did you know the first things you can work on are desensitization exercises, belly breathing exercises, emotional awareness exercises to just make sure you understand your birth experience and get help with it if you feel like you've gone through a traumatic experience. Things like that we don't often get coached on but are truly, truly so impactful. Have a look. When I teach moms how to do their own scar massages, there are two main things that they're constantly looking for. One is to ask themselves, what is my pain? And the second is, what is my mobility? Meaning, how well does that scar move? And those two questions are asked in comparison of one side of that scar to the other, but also comparing that scar to an area of your abdominals where there is no scar. So basically below belly button versus above belly button. That's how you truly know that A, you need to do the scar massage, but B, the scar massage that you're doing is effective because the results will continue to improve. Now, that is a principle that is overarching no matter whether you're just day 1 or like month 6 or further. However, you want to be able to do these techniques correctly and for you. So take a look at my next offer here. So let's piggyback off of that last slide. This mom notices that her mobility is not the same between the one movement and the next, right? It moves up and to the sides, but it doesn't move down. So she's answering that question number 2, right? Which is, what is my mobility? So that's a really good observation. Now, is this normal at 6 weeks postpartum? Yeah, probably, but it is a temporary normal, right? This shouldn't be your permanent normal. So the best way to understand how to implement your scar massage is to actually follow some coaching. I'll be running a scar massage workshop next week. So next week, Wednesday. Make sure you sign up if you have questions about, well, how am I supposed to do my scar massage? What scar massage am I supposed to be doing? What's best for my specific scar? These are the questions I'll be answering. Check out the workshop. The answer to this question is, it depends. If she's 3 months postpartum and has never done any scar massage, then yeah, swelling might be pretty normal for her, right? And in that case, yes, scar massage will absolutely work in decreasing that swelling. Now, if she's 3 months postpartum and has done scar massage this whole time, one of two questions would be accurate. One is like, have you checked in with your doctor to ensure there aren't any complications? There probably aren't. But the other one is, are you doing the correct scar massage that your body needs? And unless you're a therapist, you won't know that answer unless you work with a therapist. So I would love to recommend that you attend my scar massage workshop next week. And this is something that will help you answer these questions as you go through your cesarean birth rehab, right? You're going to learn a technique and you're going to learn how to progress it for your needs. Going back to a few slides before, you would need to do scar massage as long as the pain and the mobility of the surgical area is not the same as your non-surgical area. In a nutshell, that's when you would still need to do scar massage. Okay, and if it's all the same, then you're pretty good. Then your next question, almost simultaneous question, is what is your function, right? Are you able to control your core, right? Go back to your diastasis rehab. Are you able to, move freely while having great core control? So, from a scar massage perspective, again, you want to know what is normal, what isn't normal. Attending my scar massage workshop could be pretty helpful. It is appropriate for those that are 0 weeks postpartum all the way to 10 years. Scar massage can be very impactful if you've never done it before. Okay, so make sure you take advantage of that. Sign up for the massage workshop. It's next week. Feeling uncomfortable looking at or touching your own scar is so common. So if this is you, I just want you to know nothing is wrong with you, okay? This is so common. And it's also very important to be able to move past this. This is part of your body. And the reason why this may be happening, well, first of all, just on a very obvious level, is you've never had surgery before. It's kind of scary to be touching an area that hurts so much at one point in your life and that looks completely different. Okay? But then the other part, which is an incredibly important part of healing and physical recovery, is your emotional state. What is your emotional and psychological relationship to your birth experience? This is actually the first question